So renal artery denervation is a relatively new procedure, and what we've learned about high blood pressure is that there are nerves that start from the brain and go to the kidneys. Those nerves are actually wrapped around the artery, and we can access the artery through the blood vessels just like we do in a heart catheterization or any other peripheral vascular procedure, and send a signal through the arterial wall, through the wall of the artery, to dampen the signal of the nerves so that modulates the blood pressure. There's several different types of patients that we look for who would be great candidates. The first type of patient is a patient who's on multiple medical therapies, on multiple drugs for their blood pressure, and yet their blood pressure is still stubbornly high. The second type of patient that would be helped by this procedure are those patients who really are intolerant to blood pressure medications. We know that certain blood pressure medications can have side effects, and patients have side effects with medication. And then the third type of patients are those patients whose blood pressure is sort of borderline under control and sometimes not, but they've had an ill effect of high blood pressure already, like they've had a stroke or they've had a heart attack or they're in heart failure. But once the procedure is done and the catheters are removed, it's just recovery just like a heart cath. So no heavy lifting for a couple days to make sure that there's no bleeding around the site. That's observed for a few hours, and the patient's sent home.